So welcome everyone to our Fireside chat. Today, I have the privilege of a dynamic duo who'll be joining us. Dr. Dafina Allen, a family medicine physician and board certified in obesity medicine, and Dr. Christopher Allen, a neurologist and sleep physician. Not only are they leading experts in their fields, but they are also partners in life and co-founders of a thriving clinical practice that focuses on comprehensive care for patients with chronic conditions like obstructive sleep apnea and obesity. Doctors Dafina and Christopher Allen, it is a pleasure to talk to you both. If you don't mind, I will just refer to you as Dafina and Chris to keep it easy since you're both Dr. Allen. Again, pleasure to talk to you. So let's start with something unique about your shared practice. How does your collaboration, both as life partners and clinical partners, enhance the care that you're able to provide to your patients?
That is a good question. Thank you so much, Carlos, for having us on. I think one thing that's really cool about what we do is the fact that we are, married, and then we also have a joint practice. It's really nice because we're able to provide holistic, patient-centered care, and we know about each of our backgrounds. Chris understands how much healthy eating and fitness is important to me, and I understand about his background in sleep apnea and why he went into sleep medicine. And with our training, we've been able to learn more about how we can combine the two and just treat our patients in a really personalized way. So it's pretty good. It's pretty awesome.
That's
Yeah,
amazing.
and Carlos, again, thank you for letting me be for both of us to be in here, and I wholeheartedly agree. Being married and being life partners, and it's funny when we first moved into our practice. I'm like, yep, we're moving in with each other again, and so that was nice. And the thing that's really good about it is that because of my wife, I know somewhat about like obesity, and not as much as she knows. And I think she knows a little bit about what I do with sleep, and it makes us better doctors from that. And so, with us collaborating together, it used to be a dinner conversation, but now we do it as colleagues. And it's something that's amazing. And I wholeheartedly agree on that comprehensive care that they're getting. Because with her, when they are sleeping well, they can lose weight. With me, if they are losing weight, that can help treat their obstructive sleep apnea as well while they're getting treated.
Yeah, no, that's wonderful. You said three things that I talk a lot about, and that's the three pillars of health, being sleep, diet, and exercise. And it really is important to think about those three. And it's almost like the two of you in practice and in life together, kind of like a yin and a yang, where together you come and bring the best of, what people need and what your patients need from that holistic approach of diet and exercise and physical activity and sleep. So that's great. So let's dive a little deeper into this holistic approach and how it informs your treatment of sleep disorders and specifically obstructive sleep apnea and why addressing something like OSA, obstructive sleep apnea. If I say OSA, people just listening know that that's the acronym that I might use by accident. But obstructive sleep apnea, why addressing it is so critical.
Well, I always tell patients this, that, sleep is important. And honestly, even you can think about, like, personally reflect on yourself to think about times where you did not prioritize sleep. I know I do that for myself, and it's none different with patients. And the thing about obstructive sleep apnea, I always tell people the hardest part about my job is it's something happening when you are asleep, when you are unconscious. And so it's something that you shouldn't just write off where, like, someone says that you're sleeping, um, you're just soundly sleeping, or you're just snoring loud, or it's like, whoa, that was just a rough night. It's something that could potentially, hurt your body over time. And the thing is that, this is stepping into Dr. Chris Allen's office. I always tell people that, obstructive sleep apnea, if it goes untreated, it can lead to high blood pressure, it can lead to diabetes, even stroke. For guys, it can lead to erectile dysfunction. So a lot of bad things. And so the thing is that, if you have any of those, don't despair. Getting that treated is something that can help manage that. And also going along with and it also helps facilitate weight loss as well. And those are the things that I'm very passionate about. And so that's one of the things that I do think about when it comes to that.
And Dr. Dafina, what about from a metabolic perspective? How do you think sleep and obstructive sleep apnea plays into and can benefit from metabolic health?
So the big reason I went into obesity medicine is because, as a family medicine doctor, I was seeing so many patients that had metabolic derangements, right? And so I kept seeing patients with high blood pressure and diabetes, people having strokes, people that, had poorly controlled blood sugars. And I really did not realize how much their obesity was contributing. And so then when I learned a lot more about obesity medicine and I learned about the pillars of treating obesity medicine, really what we are trying to treat are the metabolic dysfunction that's happening, right? And so we know that when you're treating obesity, we have to pay attention, like you were already mentioning, to patients' nutrition, right? We have to pay attention to their movement. So I already knew about that part. Then I started learning more about anti-obesity medication. But when I learned a lot more about evidence-based treatment of obesity, then I found out there was another really important piece, which was sleep and how the importance of sleep really improves metabolic health. And so it was really awesome learning a lot more about obstructive sleep apnea. And I mean, I just can talk about patient after patient that was eating right and that was exercising. They were sleeping 4 hours a night or 5 hours a night, or they were snoring. They had apneic episodes and they just weren't losing like we thought, or they would lose weight and gain it right back. So then when I started learning a lot more about obstructive sleep apnea and how obesity and obstructive sleep apnea both can contribute to insulin resistance, right? They both can increase that risk of type 2 diabetes. And then the other thing about poor sleep is patients have impaired glucose metabolism. Patients have more irritability, right? Patients are hungrier. That hunger hormone is more active in patients that have poor sleep. And so addressing obesity has to include addressing sleep, or we're just not treating the whole patient.
Yeah, no, I love that. You're absolutely right. It's amazing the interplay between these things and these forces within the human body that we take for granted. And you said it earlier, Chris, that we don't often prioritize sleep, and some people wear it as a badge of honor. Oh, I'm okay with only 4 or 5 hours of sleep, but we know that you're not, because you may not everybody is acutely symptomatic every day, every morning. Those that are, fortunately, tend to seek out help when they have obstructive sleep apnea and symptoms like excessive sleepiness. But those that aren't are still setting them up for those problems later in life that you mentioned: hypertension, stroke, diabetes, erectile dysfunction. And Dafina, as you said, in the near term, people who struggle with weight or with other chronic conditions may struggle unnecessarily because they're not prioritizing sleep that will help them and help their metabolic health. So yeah, I couldn't agree with both of you more. Let's explore, because you mentioned, Chris, that as people lose weight, it may make it easier to treat their sleep apnea. What's the combination of therapy for weight loss and sleep apnea look like, especially with, CPAP as the gold standard treatment, but also GLP-1 drugs showing that they may have some effect on the severity of sleep apnea?
And I'm glad you brought that up, because the biggest thing about that, and I always tell patients this because, well, two things I was just thinking about when we're talking, especially there's going to be some people that are looking at this. And, when we say OSA, it's like that stands for obstructive sleep apnea. But then I thought about it. I was like, I always tell people at a certain level, like, okay, what is obstructive sleep apnea? So again, I'm going to have you come back into Dr. Allen's office and just tell you what obstructive sleep apnea is. I know a lot of people know about it, but even if I was like seeing the CEO of the hospital and they're in here, I'm going to talk to them like they've never heard about it before. And its bottom line is about airway collapse. So you fall asleep, all the muscles in your body relax, your legs, arms, even the muscles all the way to the back of your throat. So if that's your mouth and it's the back of your throat, when you're awake, airway's open, air's going in and out. You fall asleep, those muscles relax, and right in the back it gets small. So when you're sleeping and breathing in, that's where you hear that the snoring. That's what happens. Usually when I do that in the office, the spouse or the bed partner is like, "Yep, that's the sound." And then it relaxes, then all of a sudden the airway is closed. So no oxygen is going to your heart, lung, or brain. They don't know what's happening back there. That's where it leads to all those stress symptoms rising, your heart's pumping harder, your lungs are trying to breathe in deeper, your brain sending those stress signals, and then you wake up. Well, your body does, not you, but you fall back asleep and it happens over and over again. And that's the thing for obstructive sleep apnea. And when I talk to them about treatment, I always say, there's more than one way to treat obstructive sleep apnea. Everybody knows about CPAP therapy, and it's a good therapy to treat obstructive sleep apnea. Weight loss, and some people heard about that too. I'll have patients like, yeah, if I lose weight, yeah, I heard that you can get rid of this. And it definitely depends on severity. Because mild to moderate, you have a stronger chance of losing weight. There are studies that come out in severe cases where that can actually happen as well, which we're excited. And you have those GLP-1s that you can use to help lose weight and how I work in my practice in combination with treating your obstructive sleep apnea, because weight loss doesn't happen overnight. And so those stress signals are still like going, you're pausing and breathing. And so if you have treatment of obstructive sleep apnea, along with the way to treat your, people that have obesity, that's something that's great. And usually around 5 to 10%, you can see a decrease in your severity. If you get up to 20%, I've had times where I've been able to tell patients your obstructive sleep apnea has been resolved. And that's where I want to get to them. I always tell them it's not my job for you to use CPAP. My job is to make sure your obstructive sleep apnea is treated. And having those combinations and medications, as we talk about the GLP-1s, which my wife is a whole lot better at talking about, um, I'm very excited because it's getting our patients healthier and getting them treated.
Yeah, and Dafina, I'd love to get your perspective because, I think most of the patients who hear about this new class of medications will show up in your office first, and they'll be asking you, hey doc, I've been struggling with my weight, and I see there are these new drugs. And when you see a patient like that, obviously you know better than most physicians, since this is the backbone of your practice. A patient who comes in who's struggling with their weight or with obesity usually has other comorbidities. So they may have hypertension, they may have cardiovascular disease, they may have obstructive sleep apnea. And as Chris was saying, you have to treat both because the weight loss takes time, but the sleep apnea is happening right now. Is that how you see it when these patients show up in your practice?
Yes, absolutely. And, of course, obesity has another part to it where people, it's a chronic disease. People also are concerned about their appearance. That's normal. That's been since the beginning of time, right? But when patients, are getting their sleep apnea treated, they're also feeling better, right? And they're happier. And so that's one major win. And, the big thing with the combination treatment of obesity, meaning like if we're treating someone's sleep apnea or we're treating and their obesity or their high blood pressure and their obesity or these comorbid conditions, we know we're treating getting that comprehensive care of patients. And so the GLP-1 receptor agonist, it's a really exciting time in the field of weight management. And, we see a lot about them in social media and in the news. I mean, I tell people I prescribe these medications every day and they're very effective. Now, just like Chris was already mentioning, not for every single person, right? Same thing like with CPAPs. There's so many people that can benefit from it, and that's how the GLP-1 receptor agonists are. So many patients can benefit from them, especially when they are combined with appropriate treatment of comorbid conditions, right? So if a lot of patients that we're seeing now that have significant obesity, specifically the ones with comorbid conditions, we are seeing that not only is their obesity being treated, they're also getting treatment for their sleep. They're also getting treatment for their heart disease. They're also getting treatment for their strokes. And that's a really awesome thing. And these studies with these medications are wonderful. There's studies showing about the benefits of certain GLP-1 receptor agonists that are actually significantly improving patients with sleep apnea, significantly improving the risk with cardiovascular disease, significantly improving kidney disease. So it's a really exciting time in weight management, but the most important thing is making sure those patients are getting that comprehensive care and that we're not just throwing meds at people and just telling people, oh, here's your quick fix, because we know there's no quick fixes.
Yeah, no, I think That's very well said. And to tie that back to what Chris said earlier, the weight loss doesn't happen right away, but the comorbidities are happening now and may have been happening for
Yes.
years. And so you need to unwind that damage too. I think of a person who would show up in your office asking for help with their weight and discovering they have very severe hypertension. You wouldn't just put them on a GLP-1 and say, hey, if you lose a lot of weight in a year or two, maybe your blood pressure will be better, because they could have a devastating stroke tomorrow. You
Right.
you wouldn't do the same with someone who had severe sleep apnea. Here, take this drug. Maybe in a year you'll have lost enough weight that it'll be less severe sleep apnea. They could leave your office today and fall asleep at the wheel and get injured in an automobile accident. So we can't ignore. I love the way you guys say it. The holistic approach to the patient. A patient doesn't come in with I'm a diagnosis. I'm a single thing. No, they are a person who needs that whole person to be treated. And part of it is the comorbidities that go along with important conditions like obesity and metabolic health. So, yeah, great discussion. Now, the thing about CPAP, we acknowledge it as the sort of the gold standard treatment for obstructive sleep apnea. Is there is a bit of a stigma that's surrounded that surrounds it. It's funny, as physicians you think about diseases and their prevalence a lot, and obstructive sleep apnea has a prevalence of about 1 billion people, which is amazing. It's one of the most prevalent conditions in humans, but 80%, 800 million people are undiagnosed and untreated. There aren't that many diseases that are so prevalent that as a society, healthcare is comfortable ignoring such a large percentage. And then you get to that gold standard treatment, and if you see it depicted on a TV program or a movie, it's typically the butt of a joke. They're making fun of it. It's a big loud device, some big scary mask, and they're making fun of it. And there aren't many conditions where that's okay, but there's one that we're familiar with where it used to be okay. That's obesity. It used to be okay that fat shaming was a thing, and now we know better. So, how do we get to that point for sleep apnea and for CPAP where the stigma goes away and people realize this is a therapy that's valid and important for an important condition, especially when you realize it's just air, or in some cases, air and water. It's pretty natural and holistic, and it's a way to help you breathe. And everybody should breathe, right? So, sorry, I go on a little diatribe, but I
Yeah.
feel really strongly about this that, I have sleep apnea, and for many years as a physician, I should have known better. But even I ignored my condition because I didn't want to deal with the stigma of wearing a mask. So I'd love to hear your thoughts about that.
Yeah, and Carlos, I share that passion with you. And if anything, that's like my reasoning for being a sleep doctor. As you mentioned earlier, 80% of undiagnosed people are out there that have obstructive sleep apnea. And I feel like, anytime that I can get someone treated and get someone diagnosed, then we're helping them sleep better. We're helping them getting quality sleep. We're um, helping with their other comorbidities. And the thing is that, with CPAP therapy, yes, there is a stigma. And I think the hard part about that is that it is a diagnosis that happens when you're unconscious. People are aware of it for other people. When I have patients that come in and I talk to their spouses, I get more information from them than actual patients because they don't know what's happening. Now, of course, you might feel tired when you wake up or going to the bathroom, but we live in a society knowing that, okay, you're just tired and you find excuses. It's like, well, I'm a mom, I've been working hard. But the thing is that, obstructive sleep apnea is real. And I call it the slow killer. We've talked about what can happen along with it. And the thing is that, there's a couple of things I do to help fight that stigma. One, I just tell them what's happening. And as you mentioned earlier, it's air. Going back into Dr. Allen's office, I always tell people, CPAP stands for continuous positive airway pressure. And that last word is the most important part, pressure. You wear a mask, it provides the pressure to keep your airway open. Doesn't matter if muscles are relaxed and air is going in and out, no problem. And something so simple can make a big impact. And one of the things that I'm very fortunate to see a lot of people that I've had as patients seeing that instant like moment that they figure out, wow, I am sleeping a lot better. I have people that will do it like first night in, But usually when I see them back within 3 months, and I always call it the hindsight appointment, one, their bed partner feels a lot happier because they're not snoring and they're getting better sleep. Two, they realize like, wow, I'm not waking up constantly anymore. I'm not waking up with a headache. Months in, my blood pressure is getting better. Now I'm working with a obesity medicine provider, and I'm actually losing weight better. I was plateauing, and now that's not happening anymore. I see all of that. And so when you give them results like that, that helps fight the stigma. And then their friends will ask, like, hey, what's happening? What are you doing? Like, I went to that obesity doctor too. Like, I'm not losing weight like you. It's like, well, they help me with my sleep. So that's one way we do it, by showing them real results. And when they start to notice it for themselves. And then also, I'm very fortunate where I'm like on social media platforms, and I'll put that out there and just try to decrease that stigma, about that, and work with organizations to say that, like, look, you know, CPAP is a way to treat it, naturalize that. I always joke around when, in March and April, when it's showing like, World Sleep Day, I'll talk about how CPAP is sexy, because I'll sound like a shameless plug or a cheesy commercial and say, like, not only am I your doctor, I have obstructive sleep apnea. I've been fortunate to be treated for over 20 years, and I know how it feels personally. And that's another way that I help them out too, is that, sometimes it's like, what do you know, doctor? And I'm like, no, I actually do know. And I know that feeling. And I'll be honest with you, I didn't know there was a difference until like 3 months in, when I went on a trip and I didn't take my CPAP with me, and it felt horrible. And one of the other things that I think about as well is that there's two things: support. A lot of people don't get support with CPAP therapy. If you're following up with a sleep provider or any provider that's good at following up, or a medical equipment company where you have a device where you're working on those problems, I think that helps go against that stigma as well, because a lot of people will just get it and they didn't have that proper support. And then also having a proper mask. I always, if you have CPAP therapy, I always tell patients there's more than 200 different types of masks out there. You can find one that like works for you. It's kind of like shoe fitting. You find that right fit, it definitely does help you. And so, yeah, there is a stigma out there, but honestly, even watching movies, they're making it more, available out there to say that, hey, there's CPAP there. It's something about, um, it's a part of life, and it comes in all different shapes and sizes. It's not just people that have obesity, even though that's a strong risk factor and it helps. And that's the thing that I'm really excited about. And so we still got a ways to go, though.
Yeah. No, thank you for that, Chris. And Dafina, we mentioned the shame and the stigma that used to be applied to obesity. So you've seen, how to deal with these kinds of feelings about conditions and therapy. So how do you think about that stigma applied to the treatment and to the disease or the condition of sleep apnea? And the other thing I'd love to hear from you is the woman patient, because we tend to believe or think that sleep apnea is for overweight middle-aged men, and that is not the case. There are pediatric patients with sleep apnea. There is a strong component of certain, ethnicities where anatomy is the number one driver, and women are often undiagnosed, misdiagnosed, diagnosed late. So love to hear your thoughts on some of that.
Yes, actually, I would say my training in treating obesity has really helped in terms of even my approach to patients with sleep apnea or concern that they have sleep apnea. Because one of the big parts about my training to treat obesity is learning how to approach the patient, right? Because we know we have to treat patients delicately. There's patients that have been shamed in so many different ways about their weight, right? And made to feel responsible. And the big factor I mentioned to patients to start with is, obesity. Many factors about this are related to your genetics and hormones, how full you naturally become, how hungry you naturally become. And patients don't have control over that. And so I always want to start by saying, hey, let's help you with the things you do have control over. And it's not your fault. They might have saw a doctor for knee pain and the doctor just said lose weight. And so the patient felt responsible. And I'm like, you know what? Maybe losing weight could help improve your knee pain. However, that doesn't mean it's all your fault, right? And so that actually plays a big role for women. There's a lot of pressure, right, for women to look a certain way. And then when it comes to treating obesity, I'm always making sure we are making sure everyone understands you can be healthy at any size. I have a patient, her starting BMI with me was 45. And so when we talked about giving her an eating plan, she was snoring. She had very poor sleep. And so she said, well, why don't I just lose weight? I'm going to lose weight. And that way you think I have sleep apnea, but that way I won't have it, right? And so I'm like, no, let's first get you referred to sleep medicine. It's very likely you have sleep apnea. If you get treated, it could help your weight loss, right? Like you were already mentioning. So this patient, I actually referred her to Chris. And so she tested positive for sleep apnea. She's wearing a CPAP. Her BMI is down to 38. She's lost over 50 pounds. And so a BMI of 38, patients might be saying, oh, or someone might say, that's obesity. It is. However, she's wearing her CPAP. She's actually taken away one of her blood pressure medications now. She's moving more with her grandkids. And so that is healthy for her at this point in her life. And she's taking semaglutide that I prescribed to her, and she's changed her eating. So it wasn't just the CPAP, it wasn't just the eating, it wasn't just the semaglutide. It was, all of these factors together, but it helped the patient understand, okay, wearing my CPAP also helped me treat my obesity. And, once she got over the fact that, like, oh, because I remember her mentioning, well, if I have sleep apnea, am I going to have to wear a mask? And I'm like, let's just send you to sleep medicine. They will figure all that out. And I always tell my patients, because in the past, when I first started practicing in primary care, I would just order a sleep study. And it's good to order that sleep study. If you have access to sleep medicine, I like to refer patients to Chris's practice because my patients are happier. I always tell my patients, I'm in charge at home, right? But he's in charge of the sleep medicine. And honestly,
Wait,
he
what?
works. And he has like a sleep tech that will help patients get fitted for the right mask. And he has patients that when they're struggling to wear their mask, he helps with compliance. So instead of me just saying, yes, you have sleep apnea, go wear a CPAP, I can help my patients with more compliance. And so it's a really nice fit together. But I'd say the majority of my patients, I have a lot of men as well, but I have a lot of women patients, and helping them understand how normal it is, right? How normal it is to wear CPAP, how it's okay to take an anti-obesity medication. It's okay to get bariatric surgery. These are not crutches. These are tools to improve your metabolic health. And when we're approaching it that way, you really do get success. And that can look different for every patient.
Yeah, I love that. And it goes back to that again, what you both said in the beginning, this holistic approach, thinking of the whole patient and having the ability to, have patients referred from someone who is thinking about things like their metabolic health to the other specialist thinking about their sleep and their neurocognitive health. It's amazing. It's a great combination. You guys not only make a great conversational team. It was a lot of fun talking with you, but you guys obviously make an amazing team for your patients. So as we wrap up, just a few thoughts, and then I'll ask you one sort of closing question. You talked about how the factors that go into a diagnosis of sleep apnea, and I love when you were describing how the airway closes. And when you think about it, if 1 billion people struggle from this condition, 1 out of every 8 people, it's less of a one-off. This is not a rare thing, but it's a part of the human condition. Just like a certain percentage of people may have, flat feet or astigmatism where their eyes are shaped a little differently and they need glasses. And maybe there's a way to deal with the stigma by thinking that, like I would wear arch supports in my shoes because I want to maybe run a marathon and I've got flat feet and it hurts if I don't wear support, or I want to be able to see because I want to paint because I want to be an artist and I have astigmatism, so I wear glasses. There should be no shame in saying, I want to breathe. I just want to breathe. And so if I have to wear a little something that helps air get into my lungs so the oxygen goes to my brain and my heart, that's not that bad. So, I love the approach, that holistic approach, and the attempt to destigmatize what will help people live their best lives. So as we wrap up, thinking about all these things we've discussed, what are the words that you would say to patients when they think about their sleep, potential sleep conditions, especially something like sleep apnea? to encourage them to ask those questions the next time they talk to their doctor and not delay, and to seek treatment if they think that there's something that they should take care of now.
So I'll start. So one thing I would tell them is that, and I said at the beginning, and I like always ending, that sleep is important. You have to be an advocate for yourself. And if you think that you sleep fine, sometimes what I tell everyone, if you have a bed partner, talk to them and ask them a simple question like, how do I sleep? And sometimes it's eye-opening for that person. I see that a lot in my clinic where it's like, really? I really do that when I sleep? And so asking them, and then always being an advocate for yourself when you're talking to your primary provider. And if they're saying that, hey, I am having some problems with sleep, and if they're saying, oh, this is the way it is, and if you still feel different, ask again or ask another provider, because definitely sleep is important. And Carlos, I'm glad that you brought up the whole glasses scenario, because I always tell patients that, treating your obstructive sleep apnea is kind of like wearing glasses. If you know that you have very poor vision and it's nighttime and you're going out, you're putting your glasses on because you don't want to get into an accident. So that's the same thing with your sleep, because as soon as, no matter how long you've been diagnosed with it, if you're not getting it treated, so for example, for CPAP, as soon as you take it off that one night, it's like you've never been treated before. And I always tell people that, if I go on a trip and I'm like, yeah, I don't need my CPAP, it'll be like I've never been treated before. And so that is important. So yeah, sleep is important.
Thank you. Dafina, we'll give you the last word. You can wrap it up and bring us home.
So, obesity affects millions of patients. And so I just really want to encourage patients that are affected with obesity to not forget about their sleep, because we see so many patients that do so well when they address their sleep, when they get that sleep study, when they make their sleep a priority, when they wear their CPAP, patients get better results and they're healthier. And, we want to prevent those serious conditions that can happen. And so I'm so passionate about prevention, and that's why I love treating obesity. And so wearing a CPAP is about prevention, right? It's about improving those metabolic risks. People don't want to have a stroke. People don't want to have heart attacks. And even if people have had one, wearing a CPAP can prevent another one. So it's really a win. And treating your obesity is a win, and helping you find healthy for you, right? Not focusing on what someone else is doing, not saying, oh, this person lost this much weight, but really focusing on your own health can be so important. And treating obesity has to include addressing sleep if we want to really approach the whole person.
Well, thank you. Thank you both so much. This has been a great conversation. Your patients are lucky to have you. You guys,
Thank you.
obviously really, really care about that whole person, about that holistic approach to health. And it's been a pleasure for me to hear your take on all of this. So thank you so much. And hopefully we'll get a chance to talk again sometime soon.
But yeah,
Thank
most
you.
definitely.
Nice. Thanks so
Thank you
much
so
for
much,
having
Carlos.
us.